Hello guys, welcome back to another video on radiology. This one is going to be number 41. Let's get it. We're going to be continuing talking about the medications that we're talking about, and we're going to explore a slightly different category that may have not been obvious in the beginning, but we're finally going to get here. So get ready. Not too much to know about this slide over here. Just make sure you know the basics of it if you want to reference our past videos, but it's not going to impact your knowledge in this video. So yeah. Okay then. So as soon as you probably see at least the first image, I'm not sure if recognize the second one, but if you know the first one, you'd probably already know what we're talking about. And it's mostly going to be narcotics, okay? And these are going to be like the pain relievers. So what they do is kind of dissipate pain. And what it does is kind of like I mentioned, it goes to the specific spot, like the pain receptors in your central nervous system, and it binds to them, right? And it kind of inhibits the ability for other receptor molecules to interact with that area. And because they're not able to interact, your body doesn't sense any pain. So basically, what it does is kind of block the pain away, although it's still there, you just don't feel it anymore. But more specifically, what like morphine does, like one of the side effects of that is also constipation because it kind of affects your gut health and your digestive tract because it's kind of calming down your body and making it a lot slower than it normally is. Now, like almost any medication, it has obvious side effects, and morphine is not very specific in its side effects. It kind of depends from person to person. That kind of goes with most pain medications. It just depends on how willing your pain is and how bad your pain really is. And just based on that and how your body treats the medication, it kind of depends. If you get some chills, if you get a fever, if you get some dizziness, lightheaded, if your heart's beating regularly, it's just all very dependent on that. However, I do want to kind of touch base on the main issue of pain management or like narcotics in general. Now they are pretty like safe in the hospital, safe and secure to the most part. And I think the biggest problem kind of with them right now is like patient wise. So like most hospitals operate by giving that either through doctor orders and through like a certain pain scale that they ask the patient and the patient kind of tells them, how much pain they feel. But the hospitals also use guidelines to kind of make sure you're not getting too much and all that. But regardless, it's sometimes hard to differentiate between somebody who actually is hurting and needs something versus somebody who's kind of had it for so long that they've kind of got addicted to it and kind of need to have it in order for them to function. And their new pain norm is going to be no pain versus that's not really possible, right? You have to have some pain. Like if you don't experience anything, it's just not a good normal sense. And because some people get used to it, they want that normal. But it's kind of up to hospital staff to kind of prevent that. And I kind of want to touch base on that issue because it is a very big problem. And if you kind of know about it, it kind of helps you, contextualize and better understand treatment and all that. So yeah, I think that's pretty much it for today. I didn't talk too much specific about oxycodone, but pain medicines in general, like fentanyl, morphine, and oxycodone, are generally pretty similar to one another. Slight differentiations in how they're taken, IV, oral wise, all that. But side effects wise and what they do is almost the same, just very slight differentiations because they're made up of different chemical compositions. All right, hope you guys enjoyed this video, and I'll see you on the next one. Bye bye.